You need surgery. 3 words no one wants to hear.
I cried, I fussed, I was hysterical for at least 2 weeks before my appointment. It was very, very stressful.
But it doesn't have to be. Imagine having major surgery and feeling well enough to go home in less than 24 hours. Imagine having a hysterectomy and quickly returning to your normal routine with little or no pain and scarring. Let's talk about indications for hysterectomy. A hysterectomy may be necessary for non-cancerous conditions such as fibroid tumors, severe endometriosis, heavy bleeding, pelvic pain and uterine or vaginal prolapse, or falling. So what choices do you have for surgery? If you've been told you need a hysterectomy, you may be able to choose between traditional open surgery, a vaginal approach, laparoscopic surgery, or minimally invasive Da Vinci surgery. Traditional open surgery is commonly used for most gynecologic procedures. Surgeons have to make a long incision, often 6 to 12 inches, to access the pelvic area. Recovery can take up to 6 weeks. Da Vinci surgery is a minimally invasive approach that enables surgeons to perform complex cases through a few tiny incisions. The Da Vinci surgical system is 100% physician-controlled. Da Vinci's camera gives your surgeon a remarkably clear, 10 times magnified 3D high-definition view inside the body. This is critical for delicate, minimally invasive operations. Da Vinci instruments have tiny wrists that can bend and rotate. That allows for much more flexibility. So what do these advances mean for patients? Equal or better clinical outcomes, a shorter hospital stay and faster recovery, fewer complications and side effects, much less pain, less blood loss and need for transfusions, less risk of infection, and less scarring. During a hysterectomy, doctors remove part or all of the uterus. They gently free the ovaries from connective tissues one at a time. Then carefully remove the uterus, the cervix, both fallopian tubes, and both ovaries. The surgeon then stitches the internal opening closed, again all done through tiny incisions on the lower abdomen as opposed to open surgery through a long incision. With Da Vinci surgery, your doctor is operating in a minimally invasive fashion with a high level of precision that will often allow patients to recover in just days. Today, women don't have to have their mother's hysterectomy.
If I knew it was going to be this easy, I would have had it from day one.
I couldn't believe how much of not a piece of cake, but it was pretty easy recovery.